Greetings, my friends in the Diocese of East Carolina. I'm Robert Phillips, and I serve as the Canon for Leadership Development and Congregational Care for the Diocese of Washington, and I am delighted to be a part of your fall clergy conference. I give thanks to Bishop Skirving and Canon Roberts for extending this invitation to me to engage you in your theme of personal and diocesan renewal. So, within that context, I invite you to sojourn with me as I explore the topic spiritual direction, pastoral care, and pastoral counseling, sacred instruments for renewing the soul. While the corpus of work in the areas of pastoral care, pastoral counseling, and spiritual direction spans a vast array of personal experiences, theological perspectives, and clinical theories, my sharing with you will highlight the research findings of theologian and scholar, the Reverend Dr. Alan Jones, who incorporated into his research methodologies developed by other notable theologians and scholars, some of whom include Howard Kleinbell, Tilden Edwards, E. Glenn Henson, and Henri Nouwen. So let's begin by placing some terminology stakes in the ground. Spiritual direction has been defined as the art of the guidance of souls through the oftentimes unexpected fluctuations of the inner life, usually identified with the Catholic, Orthodox, and Anglican traditions. You may be familiar with some of the classical texts that have shaped this art of spiritual direction that include The Ascent to Mount Carmel by St. John of the Cross, and The Interior Castle by St. Teresa of Avila. The Reverend Dr. Alan Jones suggests that spiritual direction is to be understood as taking place within the household of faith. It is quasi-liturgical in that it openly acknowledges the presence of God as the third in the midst of an encounter between two people. It specifically invokes the Holy Spirit as director and guide and is, in a sense, an act of worship. This understanding of spiritual direction is in contrast to pastoral counseling, which need not necessarily make conscious acknowledgement of the presence of God. In my private pastoral counseling practice, my clients are very clear about their selection process in seeking my services. They want someone who will give them a space for grace to engage their faith, not just clinical enlightenment regarding their presenting issue. More often than not, the terms pastoral care and pastoral counseling are used interchangeably. This can be rather confusing and lead towards frustration in fully equipping one, especially for the practice of pastoral counseling. I remember during my MDiv studies at Vanderbilt, the courses in the course catalog used pastoral care and counseling interchangeably. I thought that studying for one was the same as studying for the other, but not so, not so. It wasn't until a classmate who was a social worker prior to coming to divinity school informed me of the clinical training required to engage people in conversation in a behavioral science context that I finally got that there was a difference, and it was a huge difference. So in an attempt to add clarity to this area of confusion, Jones projected that with the growing interest in spiritual direction, it might be well to begin to use the term pastoral care as an overarching term to include not only spiritual direction and pastoral counseling, but also the whole process of Christian formation in its communal as well as its individual aspects. This will involve concern for social, political, and ecological issues, as well as private and personal ones, since pastoral care has also to do with the formation of persons in community. Pastoral counseling and spiritual direction would then be understood as two branches of pastoral care. Pastoral counseling's emphasis being on the psyche, and spiritual direction's emphasis being on the spirit. Practitioners of spiritual direction and pastoral counseling maintain that, in addition to the basic distinction of psyche versus spirit, the field of pastoral counseling is highly organized, while that of spiritual direction is less so. Pastoral counseling requires the acquisition of skills, techniques, and expertise. These are verifiable and measurable. A spiritual director's role, however, is more intuitive. It relies on the gift of discernment, which is the heart of spiritual direction. This gift cannot be taught. All that can be done is to prepare the ground for further self-knowledge on the part of the person who appears to display this particular charisma. Further, another distinction lies in the tendency of pastoral counseling to emphasize self-expression and self-fulfillment. It is concerned with the functioning of the ego so that it can cope and flourish in the world. Spiritual direction, however, while acknowledging the importance of pastoral counseling, puts its energy in the direction of self-surrender and self-abandonment. John Patton, one of the leading theologians of pastoral care, suggests that pastoral care cultivates wise judgment in order to hear the hurting and offer guidance, reconciliation, healing, sustaining presence, and empowerment to those in need. Both pastoral counselors and spiritual directors agree that sometimes the two traditions seem in conflict, but there is no point in encouraging persons on a path of self-transcendence until they have developed a self to transcend. It is therefore useful to think of pastoral counseling as a necessary preparation for spiritual direction and see both under the general heading of pastoral care. You know, a recurring question among clergy has been and continues to be, when should I refer to a pastoral counselor or clinician? So I suggest that clergy should refer when you have completed 2 to 3 visits with a parishioner, if you are talking too much. You may be uncomfortable in the face of another person's pain or trauma. And remember that your nervousness may make you talk too much, or your need for answers may make you share when the parishioner really doesn't want to hear anything about your story. If you're overwhelmed, refer. And remember this as well. The deeper you go with a parishioner, the more difficult it will be when you have to refer to a pastoral counselor or clinician, because the relationship, confidentiality, and trust will have already been established with you. And it will be very hard for the parishioner to let go of you and begin establishing trust with a stranger. Now, it's key to note that not all parishioners seeking your support will necessarily present symptoms of mental illness. Not everyone has a diagnosis. However, there are some signs and symptoms of mental illness that I believe clergy should be aware of and familiar with to a certain degree. If the person with whom you are connecting shares lengthy time frames of experiencing one or more of the following symptoms, she or he may be experiencing mental illness and should therefore be referred to a pastoral counselor or clinician. Some of those symptoms include excessive fears or worries or extreme feelings of guilt, extreme mood changes of highs and lows, withdrawal from friends and activities, significant tiredness, low energy or problems sleeping, detachment from reality or delusions, paranoia or hallucinations, and inability to cope with daily problems or stress. Other symptoms include problems with alcohol or drug abuse, major changes in eating habits, sex drive changes, excessive anger, hostility, or violence, and suicidal thinking. The Diagnostic and Statistical Manual of Mental Disorders, the DSM, the latest edition, the DSM-5, that was published in 2013, is a publication by the American Psychiatric Association, the APA, for the classification of mental disorders using a common language and standard criteria. It is used to diagnose or identify a disease from its signs and symptoms. Some diagnoses reflect several types of mental disorders, which include anxiety disorders, including panic disorder, obsessive compulsive disorder, and phobias, mood disorders, including depression, bipolar disorder, eating disorders, personality disorders, post-traumatic stress disorder, psychotic disorders, including schizophrenia. I would like to now invite you into an aspect of my world as a pastoral counselor, which is the development of a client treatment plan. Note the inclusion of non-clinical resources as we go through the plan. This particular patient came for an initial examination on October the 4th, 2010. The diagnosis was major depressive disorder, a single episode severe without psychotic features. The current medications of the patient included Prozac and Ambien, and the problem or need was with respect to a depressed mood. The patient's depressed mood has been identified as an active problem requiring treatment. It is evidenced by it's present all the time, complaints of feeling sad or empty, and expressed verbally and through behavior. The long-term goal is that the patient will report depressed mood less than once per week, and the target date is approximately 3 months after the initial examination date. For a short-term goal, the patient will be able to identify and be able to explain personalized causes of depression. The frequency will be once per week and the duration will be for 1 hour, and this is currently in progress. Our target date will be a few weeks after the initial examination. Another short-term goal is that the patient will engage in the development of a personal lament psalm, which will enable the patient to articulate difficult feelings and emotions to God, thus strengthening the patient's relationship with God and overall faith, and to be able to share the lament psalm with the pastoral counselor weekly with the goal of depressed mood occurring less than 4 times per week. The duration will be 2 weeks. This is in progress, and our target date is a few weeks after the initial examination. Looking at the patient's SNAP, or strengths, needs, abilities, and preferences, these are used in the development of the patient's personal achievement agenda. The strengths include a stable environment, supportive spiritual beliefs. The needs, an explanation of the diagnosis, help in managing feelings. The abilities, able to ask for help from others, can accept and act on advice from others, can easily share thoughts and feelings with others. And the preferences include an individual therapy. The goal of the patient, as expressed by the patient, was, I want to have a lighter personal spirit. Now, let's move into an even more practical space of that which happens or needs to happen as these sacred instruments of pastoral care, pastoral counseling, and spiritual direction are intentionally used to renew one's soul. I believe that key to any conversation about clergy renewal is the need for self-awareness. Self-awareness is paramount to clergy way of being, for if we do not intentionally identify and manage our personal issues, we will project them upon the people whom God has called us to serve. Sometimes we incorporate into self-care practices that only scrape the surface of that which will really give us the energy and strength that is needed to confront the myriad of challenges that come our way. At the end of the day, self-awareness is based upon the manner in which we constructively process how we develop relationships in our lives. So I invite you to reflect upon these 5 foundational relationship quotations for self-awareness. We repeat what we don't repair. Your emotional awareness and ability to handle feelings will determine your success and happiness in life. Apologizing doesn't always mean that you're wrong and the other person is right. It just means that you value your relationship more than your ego. We are what we repeatedly do. And finally, humility is not thinking less of yourself, it's thinking of yourself less. One of the most revealing experiences of self awareness is captured in the manner in which you respond to conflict. Conflict has been a dynamic that has caused tension, anxiety, and stress throughout the history of humankind. But here's the deal. Here's the deal. When conflict shows up and interrupts our seemingly comfortable way of being, it also extends a very unexpected invitation. Painful though it may be, conflict can be a type of unexpected spiritual tool for those who desire renewal and growth. I can only imagine that you are connecting to this reality on a personal level and within the context of your role as priest, even as I speak. Well, Sabon Fusome, African teacher and writer, suggests in her book, The Spirit of Intimacy, Ancient African Teachings in the Ways of Relationships, that when conflict shows up, we may think that the best way to deal with it is to adopt an antagonistic stance toward the other person. But actually, it is best to come together and tell Spirit, we've heard the words that you sent to us. We may not know what to make of them. They are very hard, very painful for us to deal with. But we understand that it is through this trial that we will find our gifts and our wisdom. Next time, if you can, make it a little less hard. It will be really helpful because this one took a huge toll on our relationship. But we are listening and we are willing to get beyond our resistance. But we are listening and we are willing to get beyond our resistance. As I work with individuals and parishes that seek my services to handle their conflicts, their ability to listen and their willingness to get beyond their resistance is key to movement towards any degree of renewal and growth. They call me reeling from the ceiling because of whatever conflict has occurred in their lives. Therefore, if I want them to get to a point of listening and becoming non-resistant, my first task is to de-escalate their emotions. I use the 23rd Psalm as a reflection of the emotional spectrum of not only our individual lives, but also the various emotions experienced in the life of a parish. The Lord is my shepherd, I shall not want. He maketh me to lie down in green pastures. He leadeth me beside the still waters. He restoreth my soul. He leadeth me in the paths of righteousness for his name's sake. Yea, though I walk through the valley of the shadow of death, I will fear no evil, for thou art with me, thy rod and thy staff, they comfort me. Thou preparest a table before me in the presence of mine enemies. Thou anointest my head with oil, my cup runneth over. Surely goodness and mercy shall follow me all the days of my life, and I will dwell in the house of the Lord One of the best ways to de-escalate emotions is to get people to talk about themselves, not the situation or others, but about that which makes them unique. In working with parishes, I ask parishioners to talk about their unique emotional experience in being a member of the parish. Using the images in the 23rd Psalm as a type of de escalation catalyst, I ask parishioners to identify their emotions evoked upon hearing particular images. Then I ask them to identify a time in the life of the parish in which they experienced that emotion. As you may imagine, images of green pastures, still waters, and the restoration of one's soul evoke feelings of calmness, peacefulness, and tranquility. It's when they reflect upon those valleys of the shadow of death that the ever looming conflict enters the room with all its anxiety, tension, and stress. But the conflict is typically de escalated by the presence of the pre identified life giving emotions. This exercise not only de escalates the conflict du jour, but also gets them to acknowledge their identity, who they are, what makes them tick, what ticks them off. They begin to share both their beauty and their brokenness, and they ultimately reveal their parish DNA. Likewise, as I work with individuals, I invite them into a similar exercise to reveal the totality of their identity. And I impress upon them the importance of being totally transparent, not only during our sessions, but in their daily living as well. This introspective work is imperative to personal and communal renewal and growth. And it will be a work in progress in your life until you get it, or at least get close to it. Relationship coach Tracy McMillan suggests that life does not give you what you've asked for. It gives you the people, places, and situations that allow you to develop what you've asked for. And if you don't get it right the first time, life will give it to you again, because life is very generous that way. So, regarding both individual and diocesan renewal, there is good news. There is good news. For there are sacred instruments that renew the soul: pastoral care, pastoral counseling, and spiritual direction. And I invite you to do some introspective work that incorporates these sacred instruments into your life. More pointedly, I encourage you to engage these instruments within the context of how you manage conflict. Be able to name and claim that which is triggered when you experience conflict, then take responsibility to manage it. I share with the couples that I counsel who are experiencing great conflict in their relationship that while your partner may have pressed your button, your partner did not install your button. While your partner may have pressed your button, your partner did not install your button. I then continue to refocus them on the objective of our time together, which is to explore the installation experience of their button. Soul renewal is imminent as you are intentional in doing your personal work. For in so doing, you will not only heighten your sense of self-awareness, but also open yourself to a renewed sense of commitment to developing healthy relationships with God, with the people to whom you minister, and hopefully even with yourself. As I close, I share the 23rd Psalm from the Message Bible. I share it as an invitation to deep personal introspection of the manner in which you may or may not resonate with the images it uses. Prayerfully, I hope that these verses will waft in your spirit in ways that ignite a refreshingly new energy of renewal for both you and the Diocese of East Carolina. God, my shepherd, I don't need a thing. You have bedded me down in lush meadows. You find me quiet pools to drink from. True to your word, you let me catch my breath and send me in the right direction. Even when the way goes through Death Valley, I'm not afraid. When you walk at my side, your trusty shepherd's crook makes me feel secure. You serve me a 6-course dinner right in front of my enemies. You revive my drooping head. My cup brims with blessing. Your beauty and love chase after me every day of my life. I'm back home in the house of God for the rest of my life. Amen. Peace and many blessings upon you all.